Hi everybody, welcome to Health Wanted, the place to be for healthy living. Today, we are going to talk about kidney stones, a common and often painful condition, affecting millions of people worldwide each year. The prevalence of kidney stones has been rising over the past few decades, partly due to changes in diet, lifestyle, and global warming. These factors may increase dehydration, a key risk factor for kidney stone formation. Understanding their causes, symptoms, and prevention is crucial for managing this common health issue effectively. Subscribe to our channel so that we can provide you with essential information to help you maintain good health and well-being. Let's go to the video. Kidney stones, also known as renal calculi, urolithiasis, or nephrolithiasis, are hard deposits made of minerals and salts that form inside the kidneys. They can cause intense pain when they move through the urinary tract and vary in size and composition, leading to different symptoms and treatment needs. They can pass through the urinary tract and form in one or both kidneys. Larger stones can cause unbearable agony, obstruct the urine's flow, and result in infections or other issues. Smaller stones might go undetected. For people who are at risk of developing kidney stones or who have already had the ailment, it is crucial to comprehend kidney stones. This includes understanding their causes, symptoms, available treatments, and prevention measures. The formation of kidney stones occurs when the concentrations of calcium, oxalate, uric acid, and phosphate in urine exceed their solubility, leading to crystallization and clumping together. 1. Calcium stones, the most common type, accounting for about 80% of all kidney stones. Though calcium phosphate stones are also possible, calcium oxalate is the main component. Calcium stones can occur as a result of a number of factors, including dehydration, certain metabolic diseases, and elevated calcium levels in the urine. 2. Struvite stones, made of magnesium and ammonium phosphate. These stones are frequently connected to urinary tract infections, UTIs. Struvite stones can sometimes completely occupy the renal pelvis due to their rapid growth and huge size. Because they have a higher risk of UTIs, women are more prone to struvite stones. 3. Uric acid stones. Uric acid stones form in individuals who produce highly acidic urine. Individuals with a high-protein diet, gout, or a family history of kidney stones are more likely to suffer from this ailment. Warm regions with high rates of dehydration are more conducive to uric acid stone formation. 4. Cystine stones are an uncommon kind of kidney stone that are brought on by a genetic condition known as cystinuria, which causes the kidneys to expel an excessive amount of the amino acid cysteine. Throughout a person's life, these stones frequently reappear and can be difficult to manage. Causes and risk factors. Environmental, nutritional, and hereditary variables all have a role in the formation of kidney stones. By being aware of these variables, people can lower their chance of developing stones. Among the main causes of kidney stones are 1. Dehydration. Being dehydrated is one of the biggest risk factors for kidney stones. Urine concentrates more when the body is dehydrated, which raises the possibility of crystal formation. People who don't drink enough water or who live in hot climates are more likely to get sick. 2. Genetics. The chance of getting kidney stones is increased in families with a history of the condition. Stone formation is closely associated with certain hereditary disorders, including renal tubular acidosis, cystinuria, and hyperoxaluria. 3. Medical conditions. Kidney stones can develop as a result of a number of medical problems. These include gout, which raises uric acid levels, hyperparathyroidism, which raises blood calcium levels, and urinary tract infections, which can result in the development of struvite stones. 4. Medications and supplements. Kidney stones may become more likely as a result of taking certain drugs and supplements. For instance, excessive dosages of vitamin D over an extended period of time, antacids with calcium, and some diuretics can all cause stones. Furthermore, there is evidence linking specific drugs used to treat diseases like HIV, AIDS, epilepsy, and migraines to a higher risk of kidney stones. 5. metabolic syndrome and obesity. There is a connection between these two conditions and a higher risk of kidney stones. Changes in urine composition, such as increased excretion of calcium and oxalate, might result from these situations and encourage the production of stones. Uric acid stones can also arise from illnesses associated with obesity, such as type 2 diabetes. 6. Age and gender. Although the difference is closing, men are more prone than women to get kidney stones. Kidney stones are more common as people age, especially beyond the age of 40. But stones can appear in people of any age, even young children. Symptoms of kidney stones. Depending on the size, location, and kind of stone, kidney stones can present with a variety of symptoms. When symptoms do appear, they can be quite uncomfortable and unpleasant. Kidney stone symptoms frequently include 1. Severe pain. One of the most excruciating pains a person may feel is the sharp, searing pain that is indicative of kidney stones. Renal colic is the name for this discomfort, which usually begins quickly and is felt in the side or back, directly below the ribs. As the stone passes through the urinary canal, it could also radiate to the genitalia, groin, and lower abdomen. 2. Hematuria, or blood in the urine, is a typical symptom of kidney stones. It can appear pink, red, or brown. The reason for the blood is that the stone is hurting the urinary tract's lining as it goes through. 3. Nausea and vomiting. When kidney stones cause excruciating pain, especially when it lasts for a long time, nausea and vomiting may result. 4. Urination frequently. The stone might increase the need to urinate as it travels down the ureter. When urinating, this could be followed by a burning feeling, particularly if the stone is close to the bladder. 5. Fever and chills. If an infection is brought on by a kidney stone, symptoms like fever, chills, and murky or bad-smelling urine may manifest. This is a medical emergency because, if left untreated, a kidney infection can develop into sepsis. 6. Difficulty passing urine. Kidney stones can occasionally impede the passage of urine, making it difficult or impossible to urinate at all. Urinary retention is a disorder that needs to be treated medically right away. Diagnosis and evaluation. Laboratory testing, imaging examinations, and clinical evaluations are all used in the diagnosis of kidney stones. To avoid complications and determine the best course of action, an early diagnosis is crucial. Usually, the diagnostic procedure entails 1. Medical history and physical examination. Before doing a physical examination, a healthcare professional will first obtain a thorough medical history. This history will cover any past kidney stone occurrences, family history, dietary preferences, and prescription usage. Additionally, a physical examination will be conducted, with particular attention to any discomfort or pain. 2. Imaging studies. Imaging is essential to establish whether kidney stones are present as well as their type, size, and location. Typical imaging methods consist of CT scan. The most reliable and often used imaging test for kidney stones is a non-contrast helical computed tomography (CT) scan. It offers finely detailed pictures of the bladder, ureters, and kidneys, making it possible to identify stones with accuracy. Ultrasound, used frequently on toddlers and pregnant women, ultrasound is a radiation-free imaging modality. It can nevertheless detect bigger stones and identify any obstructions in the urinary tract, even though its accuracy is not as high as that of a CT scan. X-ray, KUB. A plain X-ray of the kidneys, ureters, and bladder, KUB, can detect some types of kidney stones, particularly those containing calcium. Smaller stones or stones that are radiolucent, like uric acid stones, might be missed by it. 3. Laboratory testing. To evaluate kidney function, detect any underlying metabolic abnormalities, and examine the composition of the stones, laboratory testing is carried out. Among these tests are urinalysis, can identify the presence of crystals, germs, white blood cells, and blood in the urine. In addition, it has the ability to monitor pH, which may reveal information about the kind of stone. Blood tests, calcium, uric acid, creatinine, and electrolyte levels can all be determined by blood testing. A medical problem that may be underlying or a higher risk of stone development may be indicated by abnormalities in these levels. Stone analysis. A stone's composition can be ascertained in a laboratory by conducting an analysis on it after it has been passed or removed. Customizing prevention and treatment plans is made easier with the use of this information. In the second part, we will discuss treatments, complications, dietary modifications, and much more, so you won't want to miss the next video. Share the video with a friend or family member who is experiencing these effects. That's all for today, and always remember to stay healthy. Subscribe to the channel to receive regular health tips and advice. Thanks for watching, and we'll see you in the next part.